Assalamu alaikum to all my viewers and students. Last time we have discussed many classes of the laxative drugs, which include the bulk formal laxatives, stool softeners, and the saline laxatives. Now, in today's lecture, we will discuss about the stimulant laxative, which is the most important class of the laxatives. And as I have told you that it is the third line drugs, laxative. But for the opioid induced constipation, it is the first line drug. So this class is the first line. So it works by altering the water and the electrolyte transport by the intestine, which will result in the stimulation of the motility. So it alter the water and electrolyte transport. Also work by the stimulation of the entire nervous system, which is very important, which is known as the propulsive or peristaltic activity. Pushing ability, it is the pushing ability of the the pushing ability of the intestine increases. So it how will the pushing ability increases? Because of the nerves. When the nerves get activated, then when they get stimulated, the pushing ability, the propulsive the ability of the intestine increases. So this is the mechanism. There are the two mechanisms of the stimulant laxative. First they alter the water and electrolyte movement, and second they stimulate the enteric nervous system. Now let's see the drugs, the classes of the drugs that comes under the stimulant laxatives. First is the SANA, which is very important and common. This is a single entity. When given as a single entity drug, it comes under the brand name of the Sanocort, X-Lax Paridums, and the many other for the children. And when in the combination, it also comes in the combination form with the stool softeners. It comes with the stool softeners, which is the DocuSet. I have not discussed DocuSet until now. We will discuss here. First discuss the stimulant laxatives. So it is comes under the combination form of the stool softener, comes under the brand name of the Sanocort S or Pericolase. Okay, available as a standardized, also available as a standardized concentration or as a sinusoids from the SANA leaf, like directly from the SANA leaves. It comes as a standardized concentration. Like if you have discussed in the pharmacognosy that the SANA can be used as SANA leaves can be used to treat the constipation. So by the extraction process or by various processes, these sinusoids are extracted from the SANA leaves, and they are available as a standard concentration or the sinusoids in the market. So I have written these for these brand names to let you people know that these brand names are available in the market, whether the of the SANA, whether it is the single entity as comes under the name of the Sanocort or Sanocort S means the stool softeners, or it is also available as a standardized form. So it is available in the 3 different forms in the market. So the tablet, syrups, or chocolate chewable tablets ke to. So the point is that the now comes toward the adverse drug reactions. All the stimulant laxative. Okay, first discuss the bisacodyl. Bisacodyl comes under the name of the Ducolax or the co-rectal, available as a oral and rectal both formulations. The brand names are the Ducolax and the co-rectal, and is available as a oral and rectal both formulations. The dose for the adults, as we have seen, that it is available orally and rectally both. So the doses must be for the oral and the rectal will be different. For the oral doses are the 5 to 15 milligram, while the rectal dose are the 10 milligram once daily. For the pediatrics of the age 6 or more, the dose is 5 milligram once daily oral, whether it is given orally or rectally. Now the point to remember is that the most of the laxatives are for the age of the children more than 6 years. But how will you treat the children who are suffering from the constipation and of the age of the less than 6 years? The answer is the glycerin suppositories. We will give the glycerin suppositories to the children who are of the age less than 6 years. So this is very important to remember. Also the massage of the castor oil on the belly, on the stomach of the children can also relieve them from the constipation. Now comes toward the adverse drug reaction. All the stimulant laxatives have the ADRs of the abdominal cramping, electrolyte fluid deficiencies, enteric loss of protein, malabsorption, hypokalemia, and with the suppository, it can cause a rectal burning. Like we have seen that it is available rectally. Bisacodile is available rectally, so it can, obviously it will be in the formulation of the suppository. So as we have seen in the case of the glycerin suppositories that they causes rectal burning, so same is the case with the bisacodile, it also causes a rectal burning. So we have seen the doses, we have seen the adverse effect. Now let's see what are the warnings and counseling point. How can you counsel your patient? Being a pharmacist or being a physician, how can you counsel about the stimulant laxatives? Firstly, it is contraindicated for the undiagnosed rectal bleeding. Like if a patient comes to you and say that he is suffering from the constipation as well as rectal bleeding, you should not recommend the stimulant laxative to them. Secondly, for the intestinal obstruction. Thirdly, it is not for the spastic constipation. The person who is suffering from the spastic constipation, who has spasm of the stomach, of the abdomen, as well as the constipation. This is not the drug you should give to this patient. Secondly, avoid chronic use of the cathartics. Now what is the difference between the cathartic and laxative, or cathartic and the purgative? The cathartics are the drugs that produce more fluidy evacuation, like the stool comes in the fluid form, while the laxatives is the are the drugs that causes the elimination of the soft and formed stool, like the stool is formed, while the purgatives, in the case of the purgative, the more liquidish fluid stool comes from your body. So this is the difference. So avoid the use of the chronic use of the cathartic laxatives, which among them the stimulant laxative is the most prominent. Now comes toward the cyanosoids. The problem with the cyanosoids is the urine discoloration. Now how the color will change? The color will change to the pink, yellow, red, or brown. However, this is harmless. This is not to worry about. The other problem with the cyanosoids is the bluish pigment of the mucus, which is due to the melatonin. So there are the two color changes. There are some of the drugs in the whole pharmacology that causes the color changes of your fluid secretions of your body of your body secretion, whether it is of a urine, whether it is of sweat or the lacrimal fluid. In the case of the rifampin, orange color will occur in your sweat, in the different body fluids, like sweating, in the lacrimal, tears may change to the orange color, or the urine color. So same is the case with the cyanosoids. The urine color changes to the pink, yellow, red, or brown. However, this is harmless. The other is a bluish pigment. So there are the two color problems, or the color discoloration problems with these cyanosoids. Now the very important thing about that bisacodile is the tablets should not be crushed or chewed. Why? Because these tablets are manufactured with the enteric coating. So the enteric coating should be released in the intestine, and not to be are not meant to be released the content in the stomach. So this should not be crushed or chewed. Secondly, the milk or the H2 receptor antagonist or antacids, they erode this coating. So these enteric coatings are designed to be ruptured or erode in alkalinic environment of the intestines, not in the acidic environment of the stomach. However, if you are given, if you have taken the bisacodile with the milk, or you are giving the patient antacid or the H2 receptor antagonist, so this will causes the change in the pH of the stomach, which will result in the alkalinic pH. Obviously, these are used to treat the ulcers or the acidic environment, the hypersecretion of the acid. These drugs, H2 receptor antagonist or the antacid, these are used to treat the hypersecretion of the acid of the stomach. So obviously they will cause the pH change. So when bisacodile is given with these drugs, they will cause the erosion of this coating, because the entire coating will have the alkalinic environment in the stomach. So this drug will release in the stomach. So this is not to be meant with the bisacodile tablet. It is to be released in the intestine. So should be separated in the dosing by at least 1 hour. If you are to be given, if you have to be given H2 receptor antagonist or the antacid with the bisacodile tablets, you should separate the dosing by at least 1 hour. So this is very important counseling point about the bisacodyl. Now comes toward the emollient laxatives, which are also known as surfactant, and I have, as I have told you, that they are the two drugs that comes under the stool softener class. One is the docusate, which is act as an emollient, and another is the mineral oil. We have discussed the mineral oil in our previous lecture, and now we will study the docusate. It works by allowing the water to move more easily into the stool. Like, it is not disrupting the electrolyte or the fluid balance, but it will allow the movement of the water. The water that is already present in the intestine can easily move in the presence of the docusate, can easily move into the stool and soften the whole of the stool, and it will easily move through your intestine, and it will relieve the patient. It will causes the softening of the stool. It is useful for those who should avoid the straining to pass the hot stool, especially the patient who have recent myocardial surgery or the rectal surgery should avoid the straining on their rectum or the intestine. So they are given these emollient or these emollient laxatives, which act as a surfactant. These are less effective than others. Like, they are not as effective as the other in the treatment of the constipation. So let's see more things about these. These are the source of the surfactant docusate. They contain insignificant amount of the calcium, sodium, or potassium. The products include docusate sodium, which comes under the brand name of Colase, and docusate calcium, which comes under the brand name of the cowpeptides. Dosing: how to administer these emollient laxatives. Docusate should be, each dose should be given with the 8 ounce of the water, as the administration guideline is similar to the bulk former laxatives. Yeah, they were also to be given with the 8 ounce of the water. The adult dose is 50 to 300 milligram per day, while for the pediatrics or the children less than 2 years of the age, the dose is 50 to 150 milligram per day. So this is also very important. After the glycerin suppositories, these are the drugs that can be used in the pediatrics of the age of the less than 2 years. Onset is slow, 24 to 72 hours, and the ADRs are diarrhea and abdominal cramping. Avoid in the nausea and vomiting. Like, it is also the ADRs, or if the person is already suffering from the nausea and vomiting, the docusate laxative should be avoided. It should be avoided in the appendicitis and the patient who are having the abdominal pain. So this is very important that the stimulant laxatives should also be avoided in the spastic constipation, and the emollient laxative are avoided in the abdominal pain. So both are the similar, like spasm or the pain are quite a similar, although not completely, but however related in the nature, abdominal pain and abdominal cramps. So these both the classes should be avoided in the abdominal pain or abdominal cramps. Now comes toward the opioid receptor antagonist. Opioid receptor antagonist can be given to the patient who are having the opioid therapy, or whether it is acute opioid therapy, the patient who have taken large amount of the opioid due to some reason, maybe due to the mistake or due as a part of the treatment, and they have the constipation, because it is very common side effect of all the opioids that they causes the constipation. Acute and chronic therapy with the opioids causes the constipation. So the opioid receptor antagonist can be given to treat this condition. The drugs that comes under this class are the methylnaltrexone and the albumin. These drugs do not cross blood-brain barrier, so inhibit the peripheral receptor without affecting the analgesic effect. Like, opioids are what is the main function of the opioids? Opioids are mostly used to treat the pain. Like, morphine is used to treat the pain, to relieve the patient from the pain. So the pain, it's how they act centrally to relieve the pain, but they also cause the constipation as a side effect. So these drugs, methylnaltrexone and the albumin, they do not crosses the blood-brain barrier. They do not affect the analgesic effect of the opioids. However, they reduces the side effect. They overcame the side effect of the opioid receptors. So this is very important to be remembered, that they do not affect if a patient is having the opioid therapy and you cannot discontinue the opioid from them, you can easily give the methylnaltrexone and albumin for the treatment of the constipation if the patient is having the constipation as a result of the opioid use. So methylnaltrexone used for the opioid induced treatment, constipation in the patient who do not respond to the other treatment. Like even if the patient is having the opioid induced constipation, you should go for the first line, second line and the third line drugs, as I have told you in the previous lecture. Who is the first line? Bulk former. Who is the second line drugs? Saline laxatives. Let me show you. Hyperosmotic laxative. Who are the second line? Hyperosmotics laxative, which include glycerin and the polyethylene glycol. And who are the third line? Stimulant laxative. And this, as I've told you, that the stimulant laxative are the first line for the opioid induced constipation. So first, let us clear first. A person come to you who is having the opioid therapy and suffering from the constipation. Which drug you will recommend to them? Write the answer in the comment section. Now, as we have seen that this is written, that third stimulant laxative is the third line for the general constipation. However, it is first line for the opioid induced constipation. So similar is the case. That first line is the for the first line stimulant laxative. When it does not respond, the patient does not respond to this therapy, you should go for the opioid receptor antagonist. Okay, so if the person who is having the opioid therapy as well as the constipation, first you will go for the stimulant laxative. If the patient do not respond to this treatment, go for the opioid receptor antagonist. Okay. Now, how to administer? It is administered subcut injection, 0.15 milligram per kg every 2 days. So this is the dosage that you have to given. This is the per kg, not the per day. Now let's see the alvimopam for the short term treatment to shorten the period of the, this is used for the short term treatment to shorten the period of the post-operative ileus in the hospitalized patient. Sometimes the hospitalized patient suffer from the post-operative ileus, so you can give the alvimopam. The dose is the 12 milligram capsule administered orally within 5 hours before surgery and twice daily after the surgery until the bowel functions recovered. So before surgery, you have to give 5 hours before surgery. Firstly, you will give the this capsule of the 12 milligram 5 hours before surgery, and after surgery you will give it twice daily until the bowel function recovered. Do not use for more than 7 days. It should not be given for more than 7 days. Now let's see the side effects. Due to the risk of the cardiovascular toxicity, it is currently restricted in the short term. Still, it is not that much used as compared to the other drugs due to the risk of the cardiovascular toxicity. Like this is a class of the drug, laxatives are the class of the drug that can be used on the daily basis, or like usually they can be used in the routine basis. So if they have such a adverse effect like that of the side cardiovascular toxicity, you should not be given on the daily basis. So that's why alvimopam is not given on the short term. Why? Because it has a cardiovascular toxicity. Okay, the person who could not understand what is the post-operative ileus, I have written for them. It is the intolerance of good oral intake due to the disruption of the propulsive motor activity. Propulsive is the power to propel. Like intolerance of the food or intolerance of the oral intake due to the disruption of the motor activity. Like the motor activity disrupted, motor activity of the intestine disrupted. And why this occur? This is occurred due to the surgery as a side effect, or if the surgery is of the rectum, it may be due to this. So it is used for alvimopam, can be used for the short term treatment, but due to its side cardiovascular effect, it is restricted. Its use is currently restricted. Now comes toward the population. For the pediatrics, first use non-pharmacological therapy. First go for the non-pharmacological therapy. Like what will be the non-pharmacological therapy? The non-pharmacological therapy include the increase in the fluid intake or the sugar intake. Like you can give the sugar syrup to the patient, to the pediatric patient, or you can increase the bulk content of the diet. What is the bulk content? Bulk content will be the fruits, fiber, cereal and vegetables. Now if we have to select the pharmacological therapy, the therapy should be age, if the patient is of the age less than 2 years, go for the medical advice. If the patient is more than 2 years of the age, it can you can give glycerin suppositories to them. So do not as a pharmacist, do not treat the patient who is less than 2 years of the age and suffering from the constipation. Okay, now if we see what will be the options for the pregnant ladies or the expecting ladies, these ladies usually suffer from the constipation. Why? Maybe by the enlarged uterus enlargement of the uterus. As they're pregnant, they have the fetus in them, so the uterus must get enlarged. Also due to the ingestion of the prenatal vitamins, irons and calcium supplements. They are taking a lot of the vitamins, a lot of the calcium supplements, so they may cause the constipation. And it may also be due to the influence of the progesterone decreases the motility. So these are the reasons that why the pregnant ladies get constipation. So what are the options? Must be very secure. They may be the options may be the bulk formal laxative or the stool softener laxatives. Not at all at the stimulant laxatives or the other laxatives are recommended. What options? Now let's see the for the geriatric patients. Why the geriatric patient have the constipation? Usually maybe due to the less fluid intake, they are not taking much fluid. Maybe due to the concurrent disease like hypothyroidism or the medication, especially opioids or the anticholinergics. There are the number of the medications that can cause the constipation. Specifically I have told you that opioids are the main cause of the constipation. Many patients are taking the anticholinergic drugs for the various reasons. When you discuss these, we will study these drugs and their side effects. The major concern is while treating the geriatric patients are fluid loss induced by the aggressive laxative treatments. So most of the patients, when they use laxatives, they continue to using laxatives, like they make it in the part of their habit. So this should not be should not be done to any patient, or you should guide the patient that you should not use laxative on the chronic basis. Okay, just like enemas and the high dose line laxatives can cause the fluid loss. So what are the treatment options? Treatment option are the hyperosmotic or the stimulant laxative for the treatment. While treating the constipation, you should go for the hyperosmotic or stimulant laxative. While for the prevention, bulk formula laxatives are recommended, but it also depends upon the concomitant disease. While treating the geriatric patient, you should see 2 or 3 prospects, 2 or 3 aspects. And what are these aspects? Firstly, what are the concomitant disease, whether they are suffering from any other concomitant disease or not, or they are having any other medication. So you should design your the regime accordingly, according to the patient age, according to the patient's condition, and the medication that are taking, or the medication that they cannot leave or discontinue. Now, very important aspect of the laxatives is the laxative abuse, as I have told you. It leads to the cathartic colon. And what is the cathartic colon? It is the loss of the laxatives. We have discussed different classes, and if you have any question, you can ask me through my Facebook page, or you can ask also in the comment section. Share it with your friends, and until next video, Allah Hafiz.